All right, welcome everyone to our webinar this evening. Actually, I'll start with this so you can see me better. It's wonderful to see you all here. We are streaming live on YouTube today. Normally I do my webinars on Zoom, but we had a lot of registrants, and so I wanted to make sure everyone had a spot and no one was left out of the room. So we are doing this on YouTube. So hopefully you can all hear me. Put a thumbs up into the chat because I can see your chat. I can see all of your comments. Thank you for those of you who are doing the quiz along with the slideshow. It's great to see people engaging and putting their answers in. And during the next hour or so together that we have, feel free to comment, put questions into the chat. I'll be able to see them and hopefully have all the answers for you. So again, welcome to our webinar this evening. From Aging Eyes to Ageless Eyes. I'm your host, Dr. Rani Banik, and I hope that our time together this evening will be really eye-opening and enlightening and help you on your journey towards healthier eyes. And today we're going to be discussing the 3 biggest challenges that tend to happen to most people, not just a few people, most people after the age of 40 or so, and also what you should do about them. Now, I want to make sure that I can share my slides properly. So give me just a moment here and I will get started. I hope that that is working. Okay, so you can all see that. Now I'm going to just switch over to this view right here. Okay, so I would love to begin with sharing a story of one of my patients. And this is Karen. So Karen has been my patient for some time, but she comes and goes. You know, she doesn't come on an annual basis, though she should. And she was telling me the story of recently how she was turning 55 and her family had planned this amazing dinner for her in her honor for her 55th birthday. So she was very excited. She got all dressed up in her finest. It was her husband, her family, some of her closest friends. They were all gathering together. But then, lo and behold, it was a beautiful setting. It was, kind of a very romantic mood, even though it was a huge gathering. And what she noticed was that, unfortunately, when she was trying to read the menu, she could not see the menu. So she was really distraught by this. And normally, she was telling me that she has lots of glasses lying around the house, reading glasses. And I'm sure some of you can probably relate to this, where you may have glasses lying about, one in the kitchen, one in the bedroom, maybe in the bathroom, maybe in the car. But she had left all of her glasses at home, not expecting that she would need them for this special occasion, but she was really struggling trying to read the menu. And it was her own celebration. So she was quite embarrassed, actually, that she couldn't read the menu herself. And she had to have her husband help her. And then when I started asking her a little bit more about what was going on, because again, I had not seen her in a few years, she said that she was having other issues as well. She described blurry vision for distance. She said, when she's looking down the street or even in a store down the aisle, she was having a really hard time seeing at distance. Also, she had been wearing some glasses that were quite old. I believe they're about 4 or 5 years old, and they were just no longer working for her. And when she was driving, this was a particularly bothersome complaint. She had a lot of trouble with glare. Particularly in the morning when the sun was coming in, and also in later on at dusk when the sun was setting, she had quite a bit of glare. And it really made her feel very unsafe when she was driving. And the other new symptom that she had was she noted that when she would look at a blue sky, she would see some squiggles or lines and dots kind of floating around in her vision. So basically what she was describing to me were floaters. So Karen came in with really the main complaint of blurry vision for reading, but it turned out that she had all of these other symptoms that we unearthed as we were talking. Blurry vision for distance, her old glasses not working anymore, the glare when driving, and also floaters, which were new. So I want to share with you that a lot of these types of symptoms that Karen shared are very common, and they occur usually around the age of, let's say, one's late 40s to mid 50s is usually when these symptoms begin. And again, remember, she was turning 55. That's when she noted a lot of these symptoms kind of coalescing all at the same time. And she was so distraught. She was saying, Dr. Banik, I just feel like my world is falling apart. I cannot see. Please help me. Now, please put into the comments, if any of you have had any of these types of issues. I would just love to know, some of your experiences if you've had similar types of issues. But her presentation was actually very, very common. Sorry, I'm going to go back to my screen share here. So let me just right here we go. So with her story, I wanted to open with that because it is a very common thread that once people reach a certain age, their vision kind of just goes down the drain. You know, they may have had 20/20 vision when they were younger, and then it's almost like somebody turns a switch and everything just starts to fall apart. But what I want to reassure you is that you're all here for a reason. It's to learn about what you can do to maintain healthy eyesight. And what I hope is that this next hour or so we're going to spend together is going to be the most important hour that you will invest in learning about your eyes in a very condensed time frame, that you will take away insights from this talk that you will be able to use on a daily basis, use to support your vision, and also make a plan for what to do going forward with your vision so you don't have to suffer like Karen did. Now, when we talk about vision, you know, it's one of the five senses, and there have been surveys asking people of the five senses which is the most important, and over 95% of people consistently say their vision is the most important sense of the five senses, above hearing, above taste, above touch, above smell. And hearing is just so important to almost everything. Sorry, vision is so important to almost everything we do. If you think about our daily tasks, whether it's reading a book or magazine, using a device, doing household tasks, particularly in the kitchen, for example, cutting up produce, food, preparing food, we need our vision for that. And also for going out into nature, navigating the world, maybe taking a walk, driving, we need our vision. So yes, our vision is essential to almost everything we do. However, many people don't know that our eyes do change as we age. Now, this video, this schematic is showing you the complex structures of the eyes. You know, there's the outside of the eye, and then there's the inside of the eye, including the lens, the optic nerve, the retina. There are many components to our eyes, and this is showing you a healthy eye. But as we get older, there are certain things that happen to our eyes, and I'm going to share with you what some of those things are, why they happen, you know, what are some things you can do about them. But yes, our eyes do change as we get older. It is a natural part of the aging process. It's not something, a fault of ours. It's not something we did. It's not our, you know, one specific thing. It's not only our genetics. It's a combination of things that cause changes in the eyes. Now, when we talk about these changes, again, the eye is a really complex organ. Our eye is also full of many different types of delicate tissues, and these tissues are sensitive. They're very sensitive to oxidative stress, meaning damage from free radicals, mitochondrial dysfunction. Our mitochondria are the energy producing organelles within each of our cells that help us produce energy. So we need lots of energy for our eyes to stay healthy, and our eyes are susceptible to when energy function is not optimal. Also, our eyes are susceptible to inflammation. So the combination of these three things oftentimes leads to various different eye conditions as we get older. And if these issues are not addressed early, then they may lead to irreversible damage and possibly even cell death of the retina or the optic nerve. So keep that in mind, that if we just let these kind of I guess vulnerabilities of our eyes kind of just go on their own without checking them, without doing anything about them, then our eyes are at risk, because again, our eyes are so delicate that they are at risk for permanent damage. And the goal is to prevent that from happening. We don't want people to lose vision. As an eye doctor, this is my goal, is to help people see better and enjoy healthy vision. I do not want to see people go, lose their vision or potentially even go blind. Now, the good news is, despite all of that, I just told you about the eyes getting older and all the changes that happen and all the stressors that they're exposed to. The good news is there are many things you can do within your control to stop and potentially reverse some of those aging eye issues. And the goal is, again, as I was saying earlier, my goal is to help my patients see better, but also I'm saying, for people out there who are listening, your goal is to do the things you need to do to keep your eyes healthy so you can enjoy not aging eyes, but age-less eyes. You want to have clear and comfortable and confident vision as you're getting older, despite some of those changes that do happen in our eyes. Now, what we're going to cover in this webinar. So that was kind of the intro. I kind of let you know about, okay, there are many ocular structures, things can happen to them. But what we're going to be talking about, this could go, this webinar could go on for hours, but since we only have about an hour, we're going to be just focusing on the 3 most common eye issues as people get older. And then I'm going to provide you with some DIY solutions, meaning do it yourself at home, simple things you can do to keep your eyes healthy. And I'm going to provide you with 6 insight tips, 2 for each of the eye conditions we're going to be talking about. So 3 conditions, 2 tips for each condition. And then at the end, I'll share with you what else you can do to protect your vision going forward beyond those DIY strategies. Now, I really encourage people to stay until the end, because if you stay till the end, there's going to be a free gift. So please, 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 I know, our lives are all busy. We all have multiple responsibilities and obligations, but if you can stay till the end, I would really appreciate it. Plus, you'll get your free gift. So a little bit of an incentive for you to stay. Now, before we go on, just a little introduction about myself. Some of you know me, some of you don't, but my name is Dr. Rani Banik. My full name is Rani Banik, and I'm a board-certified ophthalmologist. I'm also a fellowship-trained neuro-ophthalmologist, which means I take care of all the connections between our eyes and our brain, all the connections that help us to process vision and how we move our eyes, and it's a very complex field, but it's fascinating, the brain-eye connection. I have a private practice located in New York City. It's called Envision Health NYC. And I also teach. I'm an associate professor of ophthalmology at Mount Sinai School of Medicine, where I've been for well over 12, 13 years now, maybe more than that. And all in all, I have over 24 years of experience doing what I do in ophthalmology and neuro-ophthalmology. In addition to my traditional ophthalmology training, I am dual certified in integrative and functional medicine. I got my certification back in 2021. I started my training in 2016 in functional medicine. It took me a little while because I was working the whole time as I was doing all the coursework and the training. But what I do with functional medicine is that I look at the root causes of diseases, particularly eye diseases. And I use a holistic approach that's based in nutrition, first and foremost, botanicals, supplements when appropriate, lifestyle modification, sometimes even essential oils. I use all of these strategies to help support my patient's vision. So it's not just, as an ophthalmologist, I don't just diagnose and treat with medications or prescriptions or do surgeries. Yes, I do all of that. I do operate. Yes, I'm a surgeon, but I really do believe that when it comes to eye health, it is really a holistic approach that we should all try to follow, meaning not just the Western conventional medications and surgery, but also this holistic approach, which incorporates many of these things that are within our control. Again, nutrition, lifestyle, supplementation, and some other modalities as well. So I have been fortunate enough to help to spread this message. I've been featured on quite a few media outlets, most major news stations. Also, I've been a guest on over 100 podcasts. I also have my own podcast called the IQ Podcast. And I try to share this information with others, educate people just like you, but also educate some of my colleagues in the eye care space, both ophthalmologists as well as optometrists in the eye care space, about this type of a holistic approach to eye health. Now, this is something I say all the time. I've said this for years. Vision is a priceless gift, and we should not take it for granted. And because it's so precious, again, as I said, vision out of the 5 senses is probably the most important for most of us. We need to be proactive about it. We need to protect and preserve it. And really and most of what I do these days is really focused around protecting and preserving vision. So preventative eye care is so, so important. And I love the saying that was introduced by Benjamin Franklin: an ounce of prevention is worth a pound of cure. It's so, so important when it comes to your vision health to prevent something, to prevent a disease before it happens, before it steals your sight away. So, so critical. Now, we're finally getting to what you've all been waiting for, the three most common vision issues that happen as we get older. So again, I'll go through what these are and I'll provide you some DIY tips. And then afterwards, I will provide you with some ways that you can take the next steps with this that are not just DIY. So the three changes that happen as we get older. Number one is dry eye. Now, dry eye, as its name implies, is when the surface of the eye, the cornea, and I'll show you here in my eye model, the eye is really complex, but the front of the eye is this white part here that we all see when we're looking at someone. But this open, clear, translucent area, this is a dome-shaped structure called the cornea. And I'll see if I can take my eye model apart without dropping it all. Of course, it's stuck right here today. Oh my goodness. It's really stuck. Okay. So the eye again is really complex, but right here in the very front of the eye, you can see that there's this clear structure. This is the cornea. And this is what allows light rays to enter into the eye so they can get focused onto the back of the retina. Sorry, I just lost my cornea there. But basically the cornea is what dries out in dry eye, but also not just the cornea. The surface of the eye, the conjunctiva, can also get very, very dry. And one of the main reasons why this happens is because our tears do not provide adequate lubrication. That's, pretty common sense, right? Dry eye is surface not being lubricated properly. What I'll tell you about dry eye is that it is so common. It's estimated to affect at least 50 million people in the United States alone. This is probably an underestimate. Many more people probably have dry eye than just this number. It does get more common as people get older, but we also see dry eye in younger people, especially teenagers who are on screens all day, children as well. And also, even though women are more affected, men can be affected as well with dry eye. And to illustrate dry eye and to illustrate some of the solutions that you can use, I'm going to introduce you to another patient of mine, Susie. Susie is 52 years old. She's very healthy. She came in because her eyes began burning and she couldn't keep her eyes open any longer. Her eyes were very light sensitive. And she also had trouble driving because she just could not keep her eyes open. And particularly in the car, when she would have the vents going towards her eyes, her burning would get a lot worse. So her eyes were drying out from those vents pointed towards her face. Now, Susie had a lot of the very classic symptoms of dry eye. Dry eye symptoms can include burning, irritation, a scratchiness or kind of a gritty sensation, like there's sand or pebbles inside the eye. That's very common. Also, some people with dry eye may have some redness or swelling either of the eyelids, or redness of the eyelids as well can happen with dry eye. And another very important symptom to recognize that may suggest that somebody has dry eye is blurred vision. And this type of blurred vision comes and goes. It's not there all the time, but with dryness can come and go, and so does blurry vision. And the dryness may actually be worse at the beginning of the day or at the very end of the day. So if someone wakes up with very, very blurry vision, then after blinking or washing their face, it gets better, it's possible that they have dry eye. Or if towards the end of the night, they're trying to read and their eyes are just bothering them so much that they can't focus properly, it's possible that they have dry eye. Another symptom that patients may not recognize as from dry eye is tearing. And you may think, okay, well, isn't this contradictory? If the eye is dry, then why is it watering? Why is it tearing? Well, I'll tell you is that when the surface of the eye dries out, there is a signal sent to our lacrimal gland, which is basically under the eye socket up here. And this lacrimal gland, in response to the dryness, overproduces tears. And so the underlying issue is actually the eye is dry, and then that leads to tearing as reflex tearing. So to stop the tearing, you need to treat the dryness. That's really, really important. People don't understand that because, again, it's a little bit confusing. It's a little bit contradictory, but many people will notice that their tearing goes away once their dryness is addressed. Now, let's take a look at Susie's exam. So on the left here is a picture of a healthy cornea. Now, what we do is we use a dye called fluorescein dye, and it gives this kind of greenish, yellowish look, like a fluorescent look when we use a blue light. And so this helps us to identify if there's dryness on the surface of the eye. The image on the left is someone with a healthy cornea that's not dry. The image on the right is Susie's cornea. And you can see that she's got these areas here that are staining, these green kind of splotchy areas. These are areas when the surface of the cornea has dried out and those cells are not healthy, and they're picking up the dye, they're picking up the stain because they're just not healthy. So this is classic dry eye. Now, these are other examples of more severe dry eye, moderate dry eye up here, and then more severe dry eye here. You can see how much staining these corneas have. And again, this is because of dryness. The tears are simply not adequate to lubricate the surface of the eye. Now, when it comes to treating dry eye, this is your insight tip number 1. Remember, I told you I'm going to give you 6 insight tips today. Insight tip number 1 is you need to lubricate aggressively. And you're basically replenishing the tears that, in most cases, the tears that I can make enough tears, it's just the tears evaporate very quickly. So lubricating drops are the first line treatment for dry eye. Now, the biggest mistake people make with this is that they don't use them often enough. And when I asked Susie if she was using drops, and she said, yes, I have dry eye drops. I get those over-the-counter drops. And then I asked her, how often do you use them? And she said, oh, maybe, I don't know, 2 or 3 times a week. Well, that is not sufficient because it's almost like when you have dry skin. You wouldn't only use a moisturizer 2 or 3 times a week. If your skin is dry, you would moisturize regularly, maybe every day or maybe twice a day or 3 times a day or whenever you needed to, you would keep moisturizing, especially during cold winter weather, you may need to moisturize more. The same is true for dry eye. If you notice that your eyes are drying out, you need to use the drops more frequently. And in terms of which drops to use, well, there are many, many drops on the market. These are just a few out there in the United States. We have Refresh, Systane, Genteel, Theratears, Blink. You basically have to try different ones and see which ones you feel most comfortable with. And there are different levels of these drops as well. A couple of key things about dry eye drops over the counter. Number 1, you want to avoid Visine. Many people use Visine because it quote unquote gets the red out. But the issue with Visine is that it has a preservative and also it constricts blood vessels. And so when you stop using it, it may make your eyes look nice and white and clear. But when you stop using it, if you use it regularly, the blood vessels will actually dilate and you'll end up with more red eyes than when you didn't use Visine. So I don't recommend Visine typically as a dry eye drop. I also recommend avoiding preservatives like BAK, benzalkonium chloride. I believe that's what it stands for. BAK is a common preservative used in dry eye drops. However, it can be toxic to the surface of the eye. It can cause a lot of irritation. Some people even have an allergy to that. So I would look at the ingredients, avoid anything with BAK. I also recommend avoiding anything with polyvinyl alcohol, because PVA or polyvinyl alcohol is a cheap ingredient and it's used in a lot of the generic over-the-counter artificial tears. However, it can also cause irritation. It can actually make dry eye worse. It's not, again, it's a cheap ingredient commonly used, but I do not recommend it for dry eye. The other issue is not using the drops enough, as I was saying earlier. So you need to use them at least 3 to 4 times a day. not just once a day, not just a few times a week. You need to use it regularly. So avoid these common mistakes. When it comes to dry eye, we also have to think about what the underlying root cause of dry eye is. Now, there are many possible root causes, and I don't have enough time to go through what all of them are today. But what I'll tell you is that one of the most common root causes of dry eye is that we all have these tiny little glands in our eyelids. They're called meibomian glands, and they secrete oils. And when those oils are not flowing properly, for example, if the glands are clogged or if they get infected and you get a sty or something like that, then the surface of the eye will dry out because the oils are not there to prevent the tears from evaporating. So you need to keep your eyelid glands healthy. And when they're not healthy, it's called meibomian gland dysfunction, or MGD. And this is probably over 80% of the dry eye cases that we see in our clinics. Most eye doctors will see dry eye related to meibomian gland dysfunction. You need to keep your glands healthy. The best way to do this is to do hot compresses, but this is not what I'm in favor of, using a washcloth, running it under some hot water and putting that on your eyes. Why? Because the washcloth, it doesn't retain the heat for very long, and the heat just dissipates. You need to keep the heat on your eyelid glands for about 5 to 10 minutes to help loosen the oils and keep the oils flowing. You don't want the oils to kind of get congealed in there. You want them to be smooth and flowing. This is also a mistake that I see with using compresses. A lot of people will use hot tea bags. Again, the heat dissipates very quickly, probably less than a minute. So I would not use something like this. And some people only use whatever compress they're doing, whether it be a washcloth or a tea bag. They're only using it once in a blue moon as needed. But what you really need to do to keep those eyelid glands healthy to avoid MGD is to use an eyelid mask or eyelid moist heat compress. And this is something that you heat up either in the microwave or in a steamer at home. And you put that on your eyelids. It retains the heat for much longer, anywhere from 5 to 10, sometimes even 15 minutes. And the one I like is a Bruder Moist Heat Compress. And I will share the link with you for this towards the end of the talk. But this is something that I use myself. I recommend to all my patients. I do sell it in my online store, so you can get it there. But it's something that is very convenient, and it can really help to treat and prevent dry eye symptoms because you're keeping the glands healthy, and the glands produce the oils. Now let's go back to Susie. So with Susie, I did a pretty extensive intake. I did a couple of, as a functional medicine approach, I looked at potential root causes of her dry eye. And yes, she did have meibomian gland dysfunction. I actually took a picture of her glands. I have a camera in my office, a device that I use that can take pictures of the glands. And I saw that her glands were not healthy. She also had hormonal issues. She was in menopause. And so with reduced hormones, progesterone, estrogen, and testosterone, her glands were really suffering. So initially, I had her start treating her dry eye with artificial tears every 2 hours. I had her do the Bruder Moist Heat Compress twice a day. And then I eventually ended up doing a procedure for her called LipiFlow for her meibomian gland dysfunction. And finally, because again, she was menopausal, I recommended some compounded topical hormonal therapies. And this has to be individualized. And you do need to do this under the care of an eye care provider. It's not just something you can get over the counter. So basically, I helped Susie with these various different approaches to her dry eye. That go beyond the DIY strategies, but again, this has to be personalized through a functional medicine approach. Now, any quick questions about dry eye? I'm going to take a quick break here from my screen share. I will, let's see here. Let's see. I think we'll have time for like 1 or 2 questions about dry eye. Okay, Kimberly's asking, I was told lubricating drops make dry eye worse and you become dependent on them. No. Again, if you're using the right type of drops that don't have preservatives in them, that are not Visine, then really it's just like moisturizing your skin. If your skin is dry, why would you not moisturize? By putting moisturizer on, you're not making things worse. You're helping the surface of your skin kind of stay lubricated and stay healthy. So the same thing happens with dry eye. You're not making your dry eyes worse, and you don't become dependent on them. Dry eye symptoms may fluctuate based off of season, off of your environment, off of your other factors, your medical issues, or even like with, for example, if you wear contact lenses. So many factors can affect dry eye, but it's not that the drops are making your eyes worse. Unless, of course, again, they're irritating your eyes, like those polyvinyl alcohol drops or BAK drops. Rick is asking, what about Evisia drops? I actually really like Evisia as well. It's definitely one of the brands that I do like. So yes, that's a great ad. Thank you for mentioning that. Janet is asking, once you've been diagnosed with dry eye, do you have it forever, or can it get better over time? It can definitely get better over time. And that's really my goal. Is there's no all in all, end all be all cure for dry eye, but definitely people can have dry eye that comes and goes. I myself had pretty severe dry eye. And it was related to my contact lenses and hormonal issues. So I ended up getting the LipiFlow procedure done, and basically my dry eye went away after that. Now with my daily eyelid routine, I don't really have any dry eye. So I'm fortunate in that, and I can still wear contact lenses. So it's something that you need to talk to your provider about if you have dry eye. What's causing it and what's the best approach? And sometimes it's a multi-layered strategy, like what I recommended for Susie. It's some things that she can do at home, but then there are other things that we can do in the office for her dry eye as well. Okay, so I'm going to go back to my presentation here. 1 second. Okay. All right. Now let's move on to issue number 2 that happens with age. This is presbyopia, and I like to call this my arms aren't long enough syndrome, where people have to hold things further and further away, and many people end up using reading glasses. So let's talk about why this happens and some things that you can do for presbyopia. So the process by which we change our focus when we're looking at something at distance and we look at something up close, the process by which we change our focus is called accommodation. And there's actually a muscle inside of our eyes. And I'm going to pull out my eye model here, and hopefully I don't lose parts, and hopefully I can get it open this time. Oh my goodness, it's really sticking today. I don't know why. Okay, so let's just take a peek inside the eye. Here, this is the lens that sits behind the iris, which is the colored part of the eye here. This lens changes its shape to help you focus from distance up close. So when you're looking at something in the distance, the lens is thinner in the middle. And when you're looking at something up close, it becomes thicker in the middle. So imagine this lens is dynamic. It's changing its shape constantly, depending on where you're looking. And there's a muscle back here. This brownish kind of area here represents a muscle called the ciliary body. And this ciliary body controls the shape of the lens. And so it constantly contracts, relaxes to change the shape of this lens. And this whole process is called accommodation. Now, what happens as we get older? Well, we lose our ability to accommodate, meaning seeing things better up close, not because a muscle gets weak. The muscle is not the issue. It's the lens that's the issue. Now, this lens here is transparent, what I'm showing you right here. And when we're young, the lens inside of our eye is transparent. But as we get older, it starts to stiffen. It becomes, it lays down more and more layers of cells, and it becomes stiff. And so it's not as flexible. So even though this muscle here may still work to try to change the shape of the lens becomes very stiff. And when it becomes stiff, it becomes harder to see things up close. And this is what we call presbyopia. So for example, reading becomes difficult. Doing other types of near tasks, like for example, threading a needle can become very, very challenging. Or doing any kind of handicraft up close can become very, very difficult because, again, the lens becomes stiff. The analogy I use is, imagine you have a tree trunk, or when the tree is young, like a sapling, it's very narrow and it's kind of very, very malleable. It's very flexible. It can bend with the wind. But as the years go by, the tree trunk lays down more and more rings, and it becomes more sturdy. It becomes more firm, and it doesn't sway as much. Well, think about the lens like that. When we're young, this lens is very flexible. As we get older, it's developed more and more rings around it of cell layers, and it becomes more stiff. So that's a great analogy I like to use when I'm trying to explain presbyopia. So why does presbyopia develop? It's a lens problem. It's not a muscle problem. It's a lens problem. And who gets presbyopia? Now, this may be a little bit surprising to many of you. The answer is 100% of us get presbyopia. We all get it. If you live long enough, if you're fortunate to live long enough, you will develop presbyopia because it's a change in the lens. As it's laying down more and more layers, it's becoming stiffer. So when does it happen? Well, in the vast majority of people, over 60% of people, usually above the age of 40 is when presbyopia starts, but patients may not have symptoms until later. So again, it may be a very slow progression, and you can probably still read okay, but then you may notice, okay, I have to hold things a little further away, a little further away. And usually by most people's mid-40s, definitely by their 50s, mid-50s, most people notice that they're really struggling to read up close. And it doesn't matter whether you're nearsighted, farsighted, you will develop presbyopia. And this is probably an underestimate. It's estimated that about 1.3 billion people in the world have presbyopia. This is an estimate from the year 2020. My guess is that that's a huge underestimate, just given the population. Anyone above the age of 40 probably has some degree of presbyopia. As we get older, our presbyopia gets worse. So if you wear reading glasses, you may notice that over time, your number has gone up a little bit. Maybe initially you were okay with a +1, then you needed a +150, then you needed a +2, then a 250, maybe even a +3. That's something that happens as we get older. And to illustrate presbyopia, I wanted to share the story of my patient, Michelle. She's on the younger side. She's only 37 years old, very healthy. She's never had any vision problems in her entire life. Never wore glasses, but all of a sudden it seemed like she hit 37 and she just could not focus any more up close. And the other thing was she was on screens most of the day. So really her world was up close. She was on screens for about 12 hours a day for, work and entertainment and things like that, personal use. And also she noticed that she couldn't read the small text on her phone anymore. And so for the vast majority of people, the simple solution for presbyopia is, and this is insight tip number 3, is to get over-the-counter reading glasses. If you don't already wear glasses, let's say like Michelle, she didn't wear glasses. The simplest thing is to get over-the-counter reading glasses to help magnify things so you can see up close. And there's actually an age chart that we use. So based on one's age, this is kind of the approximate value of how much power they need to read up close. So if someone's in their early 40s, probably plus 0.75. If they're above 58, kind of the number maxes out at about 250. But there's a progression based on the lenses change where it becomes stiffer and stiffer and stiffer. And eventually it just can't accommodate anymore. And that, again, kind of maxes out at about plus 250. But for some people, if they're farsighted, as Michelle happened to be, she didn't know it at the time, but she was actually farsighted. That was her base prescription. And most of her life, she was able to focus through it. Even though she was farsighted, she was able to use her natural muscles of accommodation to focus through the blur. But it got to the point where in her late 30s, she just could not focus anymore. And her presbyopia came out. It came out early. And again, people who are farsighted or hyperopic tend to experience presbyopia at an earlier age. So it's not that this whole curve shifted, downwards in time for her. It's just that she already had a power that she didn't know about, but she really wanted a solution. So I talked to her about some device hacks. There's lots of settings on your devices you can use, even apps you can use to help you see better. So this is insight tip number 4, is use lighting hacks. You want to have good lighting. to help to really illuminate what you're looking at. I prefer like a lamp kind of going above my neck, kind of from behind, to illuminate what I'm looking at. You can adjust the settings on your phone. There's a lot of dynamic text settings that you can use depending on what type of phone you have. And there are also now many other options for presbyopia that didn't exist before. And these include various different types of eye drops. And there's another one or two that are about to hit the market soon. And even various types of surgeries or contact lenses that can be used for presbyopia. So there's many, many options now that we didn't have before. I didn't even mention nutrition, but that's a whole other topic into itself. There are certain nutrients that, in my experience, can help with presbyopia as well. So there's lots of options. So I talked to Michelle about this, what are her options? And what we ended up going with were specific types of contact lenses, which was called modified monovision. So basically what I did with her was I gave her some contact lenses where one eye was looking at distance and the other eye up close. So she was basically using one eye for distance, one eye for up close. And we also tried some prescription drops, which she wasn't a big fan of, but she did use them for special occasions, not on a daily basis for presbyopia, but just for special occasions. We did the hacks on her devices, but she's still not 100% comfortable, and she's considering getting surgical correction for this. Now, this is not for everyone. It depends on your needs, your day-by-day needs, your occupational needs, whether you need to be working a lot up close. But she was so bothered by this that she said, you know what, I've tried all of this. I tried the nutrition, I've tried the contacts and everything else, and nothing else is working. I think I need to get a permanent solution to this. So she is opting for surgical correction of her presbyopia. Again, not for everyone, but for certain individuals, it may be appropriate. So before I move on, any questions about presbyopia? I'm going to just pause my presentation here for a moment. Okay. I don't see any specific questions about presbyopia, but I'll give it a minute. If in case anyone has any questions, we can put them into the chat, into the comments. Okay. I want to keep moving because we are already at 7:44. So we're already 45 minutes into our time together today, and I want to respect your time. So let's go ahead and move on to our last topic today, cataracts. Now, cataracts, if you live long enough, just like presbyopia, if you're lucky to live long enough, you will develop a cataract. Everyone will, if you live long enough. I will develop a cataract. Everyone, if you're older than, let's say, 55, will have cataracts. But just having a cataract doesn't mean that you have to do anything about it. I just want everyone to understand that. But what is a cataract? Well, let's go back to the lens here. This is the lens. And again, it's normally clear and transparent when someone is young. But over time, the lens from oxidative stress, especially from light toxicity, can start to get opaque. And when the lens becomes opaque and it doesn't let light come into the eye, that's what we call a cataract. So it's your natural lens becoming cloudy. And that's what we see here in this diagram. On the left is someone with a normal lens. You can see their lens is clear. It's able to focus light. And this is someone with a cataract. You see there's kind of like a grayish opacity in the middle of their pupil. That's the cataract actually that people can see. You may be able to see that with a naked eye. We definitely see that under our instrumentation. But here is a cloudy lens. And instead of focusing light, it kind of scatters light. And what ends up happening is people have blurry vision. And so let me share the story of my patient, Richard. He's 76 years old, actually quite healthy, just some joint issues, but nothing major. He noted some trouble reading. He had glasses, but even with his glasses, he was having a lot of difficulty reading, especially fine print. He was unable to see in dim lighting. And then it got to the point where his vision had gotten so poor in dim lighting that he did not feel safe driving at nighttime anymore. Now, he was a grandfather. He is a grandfather of 2 young children, and he's responsible for driving them to and from school. And so that's his, his job. He is his grandchildren's chauffeur. And he was very, very upset because he did not feel safe driving them, especially when it got dark earlier, especially during the winter months. And he also did not feel comfortable driving in poor weather conditions. For example, when it was raining or snowing, he did not feel comfortable driving. So he came in, and what I'll tell you is that he had some cataracts. Again, he's 76 years old. It's expected that he have cataracts. But one of the biggest, so age is a risk factor for cataracts, yes. But there are other risk factors as well, including excessive UVA and UVB exposure. We know that when people are exposed to sunlight without protection, that they have a higher chance of developing progressive cataracts. And not only that, but UV rays can do a number on our eyes. There are many other complications from UV rays, including certain not just cataracts, but growths on the surface of the eye that are benign, even malignant growths inside the eye, which are various types of tumors that can happen inside the eye or on the surface of the eye, as well as sunburn and retinal issues as well. So UV exposure is not a good thing for our eyes. Our eyes are, again, very delicate tissues and can really be vulnerable to UV damage. So here is insight tip number 5. If you want to prevent cataracts, yes, they happen to all of us, but if you want to prevent them from progressing, you need to wear sunglasses that are 100% UVA, UVB blocking. So you're going to look for a little sticker that says 100% UVA, UVB blocking, or alternatively, it may say UV 400. So those are the little designations that sunglass is blocking. It has the correct filter to block potentially damaging UV rays. Now, a couple of tips about sunglasses. I always like to tell my patients, do not get really small, narrow sunglasses like this. You want to get as much coverage as you can, especially wraparound if you can. So I prefer the Jackie O type, large and wraparound, really to really completely block light getting in from the sides, and also to protect our eyelids as well, because our eyelids can be susceptible to UV damage and develop cancers, etc. We don't want that to happen. And what I'll tell you about sunglasses, and this is also a continuation of this insight tip number 5 that I give all my patients, is it doesn't matter what color tint the glasses are. It does not matter the price. You can get a $10 pair of proper UV protecting glasses, or you can get a $300 pair. The price does not matter. You need to look for that sticker. Again, the sticker will say either UV 400 or 100% UVA, UVB blocking. And the other thing is, if you're getting, let's say you spend a lot of time out on the water, or if you are out on, if you ski or if you snowboard, you can get polarized or mirror glasses, but that alone will not protect you. So you need to get that in addition to UV protection. Those styles like polarized and mirror type glasses and sunglasses and goggles can cut glare, but they're not necessarily blocking UV rays. So make sure it's UV blocking. Now, for Richard, he'd already been wearing glasses, and his cataracts were to the point where his vision was decreased, and he opted to get cataract surgery to try to restore his vision. And so cataract surgery is a very common, this is a cure. This is an actual cure for cataracts. And it takes the cloudy lens out of the eye. We put in a clear implant in its place to help us focus. Now, the tip number 6 that I have for you all is that if and when it's time for cataract surgery, not if and when it's time for cataract surgery, because eventually all of us, again, if we live long enough, we will need to have cataract surgery to restore our vision. And yes, you can get back to 20/20 vision, just like you had when you were in your 20s with cataract surgery. But you need to choose the right type of implant for you. So the right implant for me is not the same as for my husband or my mother or my father or my daughter when she has cataract surgery in the future. It is unique to me. So you need to discuss with your eye doctor, your surgeon, what are your needs, and choose the right type of implant for you. And there are many implants out there. There's a standard lens, there's multifocal lenses, there are accommodative lenses, there are toric lenses, and there's also light adjustable lenses, LAL type of lenses. And this is only a conversation that I mean, I can't guide you unless you're my patient, but this is a conversation you need to have with your doctor if you're planning to have cataract surgery. Is what are your daily needs? What are your activities that you normally do? And what type of lens would be best for you? Also, there are extra additional charges. The standard lens is usually covered by insurance, but the other types of lenses are quote unquote premium lenses. So there's an extra fee for those types of lenses. So Richard ended up, he did initially try some new glasses prescription, but I told him it's probably not going to do the trick, but you can try it for about 3-4 months if you'd like. So he tried them. He was not seeing much better with the glasses, only maybe one line better. So he opted for cataract surgery. So I did his cataract surgery, and he actually opted for standard surgery, no laser, standard surgery. And he went ahead with a multifocal implant. But again, this was a personalized decision to him. Does not apply to everyone, and there's no standard answer for everyone in terms of which implant is best for them. So any questions about cataracts? I will check the comments here. Okay, so Pam is asking, have you, where did that question go? Is it okay to undergo cataract surgery if you already have glaucoma? Absolutely. And actually, this is something you should discuss with your glaucoma doctor, because there are certain procedures that your doctor can do during the cataract surgery that may also help you with your glaucoma. It's called MIGS, M-I-G-S, minimally invasive glaucoma surgery. So this is something, there are many different types to choose from that you should definitely inquire about if you have glaucoma. Sky Guardian is asking, have you heard of Can-C eye drops? I have. And in my experience, they don't do a thing for cataracts. Zero, zippo, nothing. That's my experience. I've had patients try it. I've looked into the ingredients. It does not help at all, even though it says it can help. I think it has an ingredient called L-lysine, which is thought to prevent cataracts, but I have not had any success with it whatsoever in my patients who've tried it. So don't waste your money. That's my response to that. Okay, so I will now go back to the presentation here. I'm sorry I didn't get to everyone's questions, but I just want to be mindful of time. All right. Now, we've covered in a very short amount of time, we've covered 3 very important things that happen to people as they get older: dry eye, presbyopia, and cataracts. That being said, I did see some questions in the comments about other things like floaters and retinal issues like macular degeneration. Just in terms of time, there's not enough to cover all of that during today's session. But what I wanted to do is that when it comes to managing your aging eyes to help you make them ageless, whether it's dry eye, presbyopia, or cataracts that you're dealing with, first you need to understand the problem. You need to understand where it's coming from. What is the root cause of this problem? And don't just put a Band-Aid on it, but really understand what's happening in your eyes and have an honest discussion with your doctor about what's happening with your eyes. Next, you want to implement first-line strategies, preventative care, whether it be some of the tips I gave you about dry eye, about presbyopia, about cataracts, maybe incorporating hot compresses, wearing proper UV protection. Do all of those preventative measures that are within your control. And then if that's not sufficient, as you saw with some of my patients, the examples I gave you of a couple of my patients, it was Susie, Michelle, Richard, they all started off with kind of DIY strategies, non-invasive, but some of them did end up having to have procedures done. And that was their personal choice. So really understand what are your options and talk to your eye doctor about, okay, if this doesn't work, what's next? If this doesn't work, what's next? Move on to higher level strategies so you can really be comfortable with your vision. And finally, again, we did not get much of a chance to talk about this, but incorporate eye healthy diet and lifestyle choices to support your eyes. And prevention is key. It is so, so important. And I believe I have some other webinars and videos on YouTube about nutrition and supplements and lifestyle, et cetera. So you can take a look at those. Now, what I wanted to share with you next is if you're interested in going further, let's say you've had some of these issues and you really need some help and you're still struggling, you've tried some of these options and you're not quite comfortable, I wanted to introduce you all to the Ageless Eyes Signature Program. 4 weeks to prevent age-related vision decline and strengthen your eyesight. Now, this is a program that I run about once a year. Usually I do it at the beginning of the year, but this year I'm doing it in June of this year. And in this program, it's an online program, and it's really to help people really manage some of these eye issues that happen with aging. So whether it's difficulty reading in low light, dry, irritated, scratchy eyes, ocular surface inflammation, light sensitivity, which I know many people have, eye strain and fatigue, especially from being on screens all day long, from being on screens for 10, 12, 14, 16 hours a day, which many of us are. Or if you've had issues like cataracts, macular degeneration, diabetic retinopathy, glaucoma, this program is designed for you. Now, this program, again, I've run it before, but I have restructured it, and it is now much more comprehensive. So before I had very, very specific things that I would share in the program. Now I've actually broadened it quite a bit based off of some of my past students' questions and what they really wanted to get help with, to get support with. And so it is broader, and I'll share with you what's in this year's program. And the goal is to really try to recover some of the vision, restore some of the vision issues you've had, and really help your eyes feel and look like they did when you were younger in your 20s and 30s. And yes, it is possible. It is possible to have comfortable vision again. So my goal through the program is to provide you with a roadmap. And with this roadmap, you can manage some of the biggest eye challenges that can happen as we get older. Really, the goal is to maintain healthy vision as we get older, despite the passage of time. It's not anti-aging. I don't like the term anti-aging. That's why I say ageless, because yes, we're all getting older, we're all aging, but you want to really have ageless or timeless eyes so you can still enjoy your vision and do all those things you love to do. The goal is to really, keep you functional. Imagine, picking up a menu in a dimly lit restaurant and still being able to read the fine print on the menu, or looking at a label for, an ingredient label or a medicine label, prescription label, and being comfortable with that. The goal is when you go to see your annual eye, for your annual eye checkup, your eye doctor says, wow, you're doing great. You're doing amazing. Even if you have a risk of glaucoma or macular degeneration, your eye doctor will say things are stable, they're great. That's the goal of the program. And then also another goal is to help your eyes look and feel as good on the outside as they do on the inside. So yes, we're focusing on the inside, but also when your eyes are healthy on the inside, you will have a glow. You'll be able to look in the mirror and see clear, beautiful, youthful eyes, not red eyes, not tired eyes. That's what we want to avoid. And so really, it's a 4-week program. It's online. It's delivered through Zoom, and it is live. And in this 4-week program, you'll learn the key strategies to turn back the years and enjoy healthier, more youthful eyes that are ageless, both inside and out. So let me give you the structure of the program. It's taking place in June, from June 2nd through June 30th. So it's a month-long course, and there are 4 core modules. And each week we go through a different module. Week 1 is the dry eye solution. Now, what I've given you today, those are just the tip of the iceberg solutions. There are many other solutions, but also you have to figure out what the root cause of the dry eye is. And I teach you how to do that. There's a self-assessment. You could figure out, based off of your self-assessment, how you fall, what are some potential root causes, and what are some strategies you should pursue. And for each of the modules, I have a tier 1 strategy, which is more of a DIY strategy. Tier 2 strategy is something that you do in conjunction with your eye care provider. And tier 3, which is usually some kind of procedure or intervention. So I give you the 3 different tiers of strategies, and then you can determine based off of your self-assessment where you fall and what you should pursue in terms of treatment for that particular issue. That's week 1. Week 2 is the blurry vision solution. And I'll explain more about what we're covering in that module. Week 3 is macula, retina, and eye floaters solution. I know someone is asking about floaters, so we'll cover that during week 3. Week 4 is optic nerve and glaucoma. Now, week 1, I'll just explain a little bit more in detail about what you'll be learning in this module. The goal is to help you manage your dry eye by addressing its root cause, so you no longer have to suffer from common dry eye symptoms like discomfort, scratchiness, redness, tearing, blurry vision. Also, the goal is to soothe your dry eye, to help rebuild your tear film and keep a healthy tear film. We talk about daily eyelid hygiene in this module. We talk about anti-inflammatory nutrition and complete omegas in this module. And we also talk about proper application of heat, hydration, and also hormones. Now, I mentioned in my case example of Susie that I had recommended for her compounded hormone topical treatments. I'll share with you what some options are. And that way you'll know when you go to see your eye doctor, what are some things you can ask about in terms of hormonal therapies. And this is not just for women, by the way, because when it comes to dry eye, it's not just the female sex hormones that are affected, progesterone and estrogen. It's also the male sex hormones. So testosterone is also a culprit here. And when testosterone levels go low, the glands don't function well. So yes, men are susceptible to this as well. And compounded treatments can be used for men as well. So it's both for women as well as for men. Now, week 2, this focus here is on lens health. So we talk about solutions for presbyopia and cataracts. The goal is to help your eye muscles, also the ciliary body muscle, function well, to ease eye strain and reduce glare. So in this module, I share some solutions for presbyopia beyond what we talked about with the case study that I showed you. We talk about lens supporting nutrients and antioxidants, how you can get them, which are the most powerful, which are science-backed, supplementation as well. We talk about daily exercises, eye exercises to help with your lens health, focusing exercises, visual hygiene habits, and also if you are someone who is considering cataract surgery, I guide you through what are the options and how you can choose. So, this is something that was really empowering, because if you have this information now, when you go see your doctor about cataracts, let's say it's time to get cataract surgery, and for everyone, it's a different time, different stage in life. But whenever that time is right for you, you will be empowered with the knowledge and you will have the right questions to ask. And again, you want to just be empowered with this before you go in for that consult, so you know what are the options and to best approach the solution. Okay, week 3, macula, retina, and vitreous solution. So here we talk about, this is a big module. We have a lot of topics we cover in this module. And when my previous courses, Ageless Eyes, I did not cover this specifically. So this is something new, this module. And it's because of popular demand. A lot of people ask for specifics about macular degeneration, about macular pucker, about floaters, about diabetic retinopathy. So we cover all of these retina, macula, and vitreous topics in this module. We talk about nutrition for macular health, how much, where you get it from, should you supplement, who should supplement, also some lifestyle strategies for retinal health, light therapy. I know that there's a lot of buzz around light therapy, whether it be red light, infrared light. So we talk about that during this module. Photobiomodulation is the medical term for it, light therapy. Which wavelengths to include, which ones should you avoid, like blue light, and which wavelengths of blue light should you avoid. In this module, because we're also covering diabetic retinopathy, we talk about blood sugar control, how you can best optimize your blood sugar. And we talk about blood vessel health and detoxification. So this is a big module, and I'm so excited to share this with you, because this will be the first time I'm teaching this module as part of the Ageless Eyes program. This is why I'm calling it the Ageless Eyes Signature Program, because really it's all encompassing. And even though you may not think that you have this problem now, you may develop it in the future. You may develop vitreous floaters. You may develop a macular pucker at some point in your life. So it's good to know about the problems now before they happen, so you know you can prevent it from happening. Really, that's the goal. Okay, week 4, module 4, is focused on the optic nerve and glaucoma. And we talk about optic nerve health, neuroprotection, improving blood flow, and reducing eye pressure risk. Eye pressure is a risk factor for glaucoma, by the way. In this module, we talk about sleep, we talk about stress, we talk about circadian rhythm and the IOP connection. IOP is intraocular pressure. We talk about nutrients and lifestyle habits to support your optic nerve. And we talk about nervous system reset and breath work. So there's a lot we cover in this module as well. Now, this is the way the program is set up. So every week in the program, there are 2 live sessions. Monday at 12 p.m. Eastern, 9 a.m. Pacific, we will have our didactic webinar session. And then Friday, we will have a live Q&A with a recap of what we've learned. Also, you can ask your questions live. You can share your experiences. You can share some recipes. We do a lot of cooking during Ageless Eyes as well. I shouldn't say it's not all cooking, but just food preparation, because nutrition is a thread that carries through all of the modules as well. Nutrition lifestyle carries through all the modules. So I share recipes. So we share a lot of that during our live session on Fridays. Also, I forgot to mention this. We begin with a guided meditation. I love starting with a guided meditation every single Friday session. It's really relaxing, and it'll just put you in the right mindset to learn, really. And then also as part of the program, you will get exclusive resources. You'll get curated eye recipes, products that will help you keep your vision healthy and strong to help keep your eyes ageless. And then there's also a community forum in the course portal called the Ageless Community Forum, where you can post your recipes, you can post shares, you can support each other. And, again, this is a joint effort. We're all doing this because we care about our vision. And by the way, there's also a bonus module as part of the Ageless Eyes Signature Program. This bonus module is the Youthful Solution Beyond Cosmetic Surgery. So this addresses a lot of the age-related cosmetic changes that happen around the eyes. So dark circles under the eyes, bags and sags of the upper lids, the lower lids, also fine lines and creases. What can you do to manage these issues? What can you do from a preventative standpoint? From a DIY standpoint. So talk about what are the best creams and serums and products that you can use. And then finally, if anyone needs to have a procedure done, whether it be an injectable or a surgery, then how do you choose which surgery is best for you? So I will help guide you in that sense as well. So basically, I'll be your guide for these 4 weeks. So this is, again, how it's laid out. 4 weeks, 4 topics, plus the bonus one. We have live sessions together Mondays and Fridays. And by the way, the time again is 12 p.m. Eastern, 9 a.m. Pacific. They are all recorded, and the recordings will live inside your portal. You will have unlimited access to the recordings and all of the resource material as well. And by the way, on the last Monday together we have is June 30th. That is our graduation. And I love the graduation celebration. It's really a celebration of you and what you've done, what you've learned to support your vision. And we will also cover some Q&A about the Youthful Solution, the bonus module during this day. But really, it's a lot of sharing and it's a lot of community work that we do together during this session. I really, that's my favorite part. Even though the course is ending, it does make me sad. It's really my favorite part of the whole program. So the Ageless Eye Signature Program, this is what you'll get. 4 core modules: dry eye solution, blurry vision solution, macula, retina, and vitreous solution, and the optic nerve and glaucoma solution, with the bonus module, the youthful solution. That alone is priceless, because if you think about what it costs for Botox or a filler or a surgery to lift your lids up, I mean, that is in the realm of thousands and thousands and thousands of dollars. Not to mention how priceless your vision is, but the bonus module itself is phenomenal. I loved giving that because people's eyes are just open, like, oh my goodness, I had no idea I could do that. That's a simple DIY strategy. I don't have to have eye surgery. I can do this instead, at least for a couple of years before I end up having to have a procedure done. So it's been great to try to help people make those decisions along the way. Also, as part of the program, you get the resources, you get worksheets, you get self-assessments for each module. You get the tiers, the tier 1, tier 2, tier 3 approaches. You get product guides, checklists, and recipes, and you get to join the community. The lifetime value of this is priceless, because if you think about your vision, we should not be playing games with our vision. Really, it's so precious. We need to protect and preserve it. The lifetime value is priceless. The cost of the program is $597. That's the regular cost of the program, but there is an early bird special of $297, which is 50% off if you purchase the program before it starts on June 2nd. June 2nd is Monday, by the way. So in less than a week, if you purchase the program before then, you get 50% off. Now, this is the last time I'm going to be doing this live, completely live. In the future, if you do this program next year or the year after, it will not be live. It will be pre-recorded. And so you get the benefit of going live, asking me questions, and getting, a lot of great insider tips. And because you're on the webinar today, there's a special fast action bonus. So if you register by the end of today's webinar, and I'm going to go ahead and grab the link and put it into the chat for anybody who's interested in this. Let me just put this right here. You can get, okay, that is not working. 1 second. If you purchase it before the webinar, or for the webinar special, basically the webinar special will be until midnight tonight, Eastern time. You can get it for $247, which is a 59% savings. It will never be this low again. So if you're interested, I strongly encourage you, join us for the AGELESS Signature Program. Again, I only do this once a year, but this is the last time it will be live. And I'm not sure why the link is not working as a link. Let me see if I can fix that for you. Hopefully that works now as a link, or you can copy paste it, hopefully. I think we have a question here. What are the times of the Zoom session? So Jan, it's 12 p.m. Eastern, 9 a.m. Pacific time. And it's the same on Mondays and Fridays. We meet at the same time, Mondays and Fridays. Okay, so let me go on here with my presentation. Let me see, switch back here. I hope you can all see this. Okay, so again, $247 if you enroll by midnight tonight, which is the webinar special. Otherwise, the price is going to go up to $297 tomorrow morning. And also, we only have 100 spots available. Because I really want to be able to provide you all the support you need. I can't have more than 100 people in this program. Usually every year we sell out. And this year we've had thousands of people register for this webinar. And I'm sure many others will be watching the replay. So please, 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 if you're interested, register as soon as possible, because guaranteed this program will sell out. Now, when you do click the link, this is what you will see. You will see the price is already there. You don't have to include any coupon or anything like that. The price is $247. You enter your information. Here you see you put your name, you put your email, you can put your phone number, and then you can enter. You can put your payment method. Now, there is a money back guarantee for this. So if you're on the fence, if you're not sure if this program is right for you, I am so confident you're going to love this program, because in the past, so many of my students it's been transformational for them. They've gone through the program and they have so many insights about their eyes, about what they need to do to keep their eyes healthy and reverse some of the changes that have been happening. I really think you're going to love the program. But in case it's not right for you, it's not right for everybody. I understand that. But what I would do is I would encourage you, in order to qualify for the money back guarantee, you must attend the first week. So Monday and Friday, even if you can't attend live, you need to at least watch the recordings, and we can keep track of who's watching. If you decide after that first week it's not right for you, we will refund you completely what you paid. So you have that 1 week to trial the program. And again, if you don't like it, no questions asked, we will refund you the money. And I have to say, in the years that I've been doing this, only one person asked for a refund, only one. And that was only because she had a big conflict with her work, her work schedule, and she really wanted to participate live and she couldn't, and she didn't want to watch the replays. So she asked for a refund, but then the following year she took the program live. So only one person requested a refund. And again, you need to request it at the end of the first week, the 5 days. I want you to participate first before you make that decision. If you don't like it, if you don't want to participate, if you don't want to continue, you just have to email us by saying, I'm not satisfied with the AGELESS signature program, and we will refund you, no questions asked. And the refund usually takes about 7 to 10 days to process. So just be aware of that. And again, this price will go away at the end of our time together. So I will stay on for another 10 minutes or so. I'm just going to keep the timer going here because I want to be mindful of everyone's time. We've already gone about 15 minutes over, but I will go back and answer any of your questions that you may have. Okay, let's see. And then, of course, there's the free gift at the end. So hopefully you can all stay and you can take advantage of that free gift. Okay, so there's one question from Shruti who's asking, does high power myopia put you at risk of developing cataracts early? It can, but the higher risk is more to your retina and the optic nerve. So people who have high myopia are at much higher risk for developing a retinal detachment and also glaucoma, as well as lacquer cracks. So there's a lot of things that can happen with high myopia. Yes, you can develop cataracts, but cataracts are treatable. They're curable, but some of these other issues are more vision threatening. And that's why it's really, really important to go see your eye doctor once a year and get that annual checkup once a year. Okay. Okay, so Jan is asking, can you discuss the types of lenses? I'm sorry, Jan, that's actually part of the module 2, where I go into in-depth all of the different types of lenses. We don't have the time here to do that because that's actually, it's a pretty extensive discussion because I explain what the lenses are, what they're used for, who it may be appropriate for. So I won't be able to do that during today's webinar. Okay, Michael's asking, in what ways are the premium out-of-pocket contacts better or superior to ones covered by insurance? I'm not really sure what you mean by out-of-pocket contacts. I'm assuming that you mean like specialty contact lenses. So basically, if you have a certain eye condition like keratoconus or some other corneal issue, your eye doctor may recommend a specialty contact lens. Or even sometimes I recommend tinted contact lenses for some of my patients, depending on what their issues are. And so for them, I would recommend, usually it is covered by insurance, though. If it's a medical indication for the contact lens, usually it's covered by insurance. I'm not exactly sure, Michael, what you're referring to there. All right, any other questions? Okay, so I see some questions about the program. So Pam is asking, can you send us an email? Yes. So after the webinar today, you will get a link to the recording, and you'll also get a link to go ahead and enroll in the program. I can see some people have already enrolled, which is wonderful. So thank you for those of us who've joined us already. And so, so you will get that. But again, in order to get this price of $247, you need to enroll by midnight Eastern today. Otherwise, the price, it's already set in our system. That's the webinar only special. It will expire. It will expire. So you need to get that, again, in the next few hours that we have before midnight. Okay, so Michael's asking, he was referring to the cataract lens. Yes, so sorry, I need to go back to your question here. Okay, so again, Michael, as I was explaining earlier, that is a huge discussion about how they're different than a standard lens, what their indications are. So I won't be able to cover that today during the webinar, unfortunately. Okay, so I wanted to, let's see. Larry's asking, is red light therapy safe and or effective for macular degeneration? Yes, it is actually FDA approved. Just a few months ago, red and infrared light therapy was FDA approved for macular degeneration. And it is also in clinical trials for glaucoma. And also, it's been shown to be helpful for children with myopia progression. So it is safe and it has potentially many therapeutic benefits. So we covered this in week 3, module 3 is all about light therapy. Not all about, because there's a lot of other things we cover as well, but light therapy is discussed during that week and that module. And how do you do it? Because it's not commercially available yet. And also most eye doctors' offices don't yet have that capability for the, in terms of the device. So how can you kind of go around that? And we don't know yet when it's going to become commercially available for you to have, for example, in your home to use light therapy. So I do share some of my own experiences with it and some of my patient experiences with it. There are devices that you can purchase. I'm not a fan of all of them, so I do share kind of which are the ones that I prefer and which are the ones I would stay away from. And again, that's in module 3. Susan Diamond is asking, can any non-surgical techniques help with macular pucker? So macular pucker is not a topic we're covering today, Susan, unfortunately. We're sticking to dry eye and presbyopia and cataracts because, again, if we covered everything, we would be here for hours and hours and hours. So there is a segment on macular pucker in the course, what people can do for it, as well as to support their retinal health, their macular health. So there are some other things that can happen to the macula as well, aside from macular degeneration. So I share what you can do for that. Also nutritionally, what you can do for macular issues. Okay. So Shira's asking lifetime access to the program, right? Yes, it's unlimited access. So you will be able to go back, you will be able to rewatch whatever you would like to, as many times as you'd like, download all the resources, you'll have access. Absolutely. Okay, so if there are no other questions right now, I am going to finish up with the webinar, and I know I promised you all a free gift. So I'm going to share with you my dry eye guide. So I have a best dry eye product guide. So in here, I hope that it works. I'm not sure if that's gonna, let me just repost that here for a second. I don't know if the link is going to work, but if someone could try it and please tell me if it works, because I want to make sure that you're all able to access it and download it. Here we go. Maybe this will work this time. So in this guide, I talk about the different brands of dry eye products on the market, the over-the-counter drops, and there's so many different types of them. There's regular, there's, for example, Refresh alone has so many different subsets, and Sustain alone has so many different types, and ointments and drops and viscous drops and gel drops. So how do you decide which one is best? And then some other products that I really like for dry eye. And by the way, I will also said that I would share with you the Bruder mask, which you can get on my website. So here's the link to the Bruder mask. Hopefully that works. Let me redo that one as well, because I'm not sure if the link there is working. So let me do this again. There are other masks you can get as well, but I like this one because it's both eyes at the same time. Some of the other masks are just one eye at a time. And this mask has actually moisture beads inside, so it retains the heat for a very long period of time. I can't tell you how many times I've had patients who've had styes who swear by this mask because they maybe have gotten multiple styes and they didn't know what to do. And when they started using this mask on a regular basis, their styes basically, never came back. So it's really, really helpful in keeping those glands healthy. And Bruder is a trusted company. Many eye doctors trust it. It's been around for a very, very long time. They make a lot of different products as well. But the mask is, I think, an essential. And if you don't have a microwave, that's totally fine. You can put it into like a little steamer basket. You can heat it up in a steamer. Just don't get it wet because then it gets kind of messy. But I would just heat it up whatever way you prefer. In the microwave, it's only about 10-15 seconds. That's all you need, no longer than that. And then you put it on your eyes and you can feel that heat and moisture getting to your eyes. And it's very, very calming, very, very soothing. Okay. All right. Thank you, Michael, for confirming that the gift is working. So again, you can access the free gift, which is my dry eye product guide. You can download that. And all right, well, if there are no other questions, I will conclude today's webinar. Thank you so much for joining me and staying. It's been over an hour that you've been with me, so I really appreciate it. And again, you'll get an email later today with the link to watch the replay, as well as the link to enroll in Aegis Eye's signature program. I hope to see you there. It's a really fun program. Really we build a strong community together. So it's enjoyable while learning about your eyes. And it's pretty much the most comprehensive eye program you'll find out there. I don't think that there's any other online program that will support you in this way to this extent. But I hope you check it out. Remember, there's a money back guarantee. Try it out for a week and see how you like it. Anyway, I hope to see you in the program. And I wish you all a wonderful rest of the day. Take care, everyone. Bye-bye.